HBM is a key component of recent environmental epidemiology studies. For example, in our nationwide birth code study, named Japan Environment and Children Study, or JECS, which involves over 100,000 mother and child pairs. We use HBM technique extensively. The study is aimed at identifying environmental factors that affect children's health and development and helping the government design better risk management strategies. Especially, JECS focuses on the effect of prenatal and early childhood exposure to chemical substances. This study started in 2011 and maintains over 90% of the participants. JECS is planned to continue for more than 40 years. We have been analyzing many chemical substances in biological samples collected from our participants. The chemicals of interest include metals, persistent organic pollutants, personal care products, and so on. HBM data can be used as a surrogate of a total body burden of a chemical of interest. Then we can connect HBM data to health outcomes in the cohort studies and tell the international research and regulatory community whether and how a particular chemical affects our health. Using these epidemiological results, we can develop health-based guidance values for interpreting population-based HBM results. Exposure sources of a chemical or mixture of chemicals can, in many cases, be multiple. Internal doses of chemicals are often associated with health outcomes better than modeling external exposures from various sources. Thus, using HBM in cohort studies, we can make exposure assessment more effective and accurate, which results in less certainty in the epidemiological findings. Conducting cohort studies take time and cost. Assessing chemicals one by one in cohort studies is not realistic. Using HBM technique, we can assess not only chemical mixture exposure, but also effect mechanisms. We may be able to reveal the effect mechanisms by looking at effect markers. Mechanisms of action enables us to understand what type and function of chemicals pose what kind of health effects. This will lead to safer chemical design in the future. Health-based guidance values can be directly derived from the cohort studies if the HBM technique is used. Such guidance values can be used in other populations with an appropriate extrapolation. The HBM results in the cohort studies can also be used as a point of departure for risk assessment of chemicals. In these ways, HBM is very useful in the epidemiological studies.